Our next guest is a Detroit native who, for over 20 years, has been serving people as a medical professional, a surgical oncologist. But it was a trip to the Himalayas that changed his life and added a new layer to his mission to help save lives all across our local area and throughout the world. Joining us is Dr. Richard Keidan. He is the co-founder of Detroit2Nepal Foundation and joins us now on the Splash Live. Dr. Keidan, thank you so much for your time today.
Good morning. It's a pleasure to be here.
Yeah, glad to have you on to talk about this because I saw some posts about your organization, Detroit to Nepal Foundation, or D2N, on social media recently, and it caught my eye because the story behind this is so profound. So just take us through briefly what the origin of the Detroit to Nepal Foundation is and some of the work that you're doing to this day.
Sure. So I've always enjoyed the outdoors, and that enjoys both canoe tripping and hiking in the mountains and climbing in the mountains. I've been going to Nepal since 1983, and on one of my trips about 15 years ago, my lead guide, which is called the Sirdar, his name was Namgyal Sherpa, and he invited me to come back to his village area to do some medical work. And as you can imagine, if I came back to his village area with a duffel bag of medicine and a stethoscope, I wouldn't do anything very sustainable. So I just asked him to come to his village area, see what the status quo was, do some assessments, and then try to decide how we can best help out. So that was kind of the origins of Detroit to Nepal about 15 years ago. Since that time, we've been working with both public health, healthcare, and education for the communities in Nepal. And a couple years after we started the foundation, we also started doing the same type of work in Detroit neighborhoods.
And we'll come back to the work that's being done locally here in Detroit neighborhoods and in our local area. But the work continues in Nepal. You mentioned that it was a major earthquake a number of years ago that sort of was the catalyst behind a lot of the philanthropic work and the relief work that your organization and its partners are doing in Nepal. Your most recent trip to Nepal provided even more relief to an earthquake zone in western Nepal in the Jarjarkot district in the Karnali province in western Nepal. Tell us about this particular work that was done fairly recently. Despite it being a smaller earthquake than in 2015, still had a major effect on this community.
Sure. Yeah, as you mentioned, the 2015 earthquake not only affected Nepal across the entire country, but many other countries in the region. This earthquake was much smaller in its effect, but had a very dramatic effect for these communities. You'll see some of the slides. There were tens of thousands of people in this area that were rendered homeless by the earthquake. Over 800 schools were damaged, including over 200 schools completely destroyed. So it had a profound earthquake for this one area, and this area, Western Nepal, happens to be the poorest area in the entire country. So when we first started providing some relief, it really was a matter of getting them through the winter. People were living outside, so we provided tents and tarps for temporary shelter, clothing, food, blankets, medicine, all the things you can imagine it would take just to survive. Uh, we also evacuated injured adults and children, children that were rendered orphans by the earthquake. We brought down to this Sirket area to my friend and colleague's orphanage, Kapila Valley Children's Home. Pregnant women were brought down to urban areas to get medical care. So there were just a lot of emergency efforts just to, be on survival mode. Now that we've survived the bulk of the winter and people have some temporary shelter and enough food and some basic medicines, they've asked us to provide help with rebuilding infrastructure. The philosophy of D2N, Detroit to Nepal, has always been to respond to the priorities that the communities identify, and they've identified school rebuilding as their number one priority. In 2015, we rebuilt 11 schools in the Khotan district in the eastern Nepal. We also built a couple medical clinics and birthing centers at that time as well. So now we're in the planning phase of rebuilding some schools. Our initial plans will be to rebuild 4 or 5 schools in conjunction with the communities. So the local communities are in charge of this process. They do the actual construction, they participate and have ownership of these programs. And once they're up and running, we hope to also implement some programmatic changes. My partner in this effort is Maggie Doing from Blink Now. She has an orphanage and children's home in Surquette, about 50 miles from the epicenter of the earthquake. And she's going to be the specialist that's going to help with some programmatic changes once the schools are rebuilt.
More information can be found on D2N's website, Detroit2Nepal.org. That's Detroit2Nepal.org. You can also follow them on Facebook and Instagram. Their handles on both of those social media also are Detroit2Nepal. Dr. Richard Keidan is joining us on the Splash Live today to talk about this organization that he has founded and runs from right here in our local area. And you mentioned some of the relief more recently, and you've been to Nepal as recently as December of 2023 to provide this relief and to these communities. You mentioned the schools being a particular area of devastation that they're hoping to have rebuilt and repurposed as soon as possible. Talk to us just about the extent of how much they lost in terms of schools that were damaged or destroyed in even just these most recent earthquakes.
So again, in this most recent earthquake, over 800 schools were damaged and over 200 were destroyed. So obviously we can't rebuild all of those, but we're certainly hoping to at least rebuild 4 or 5. As you can imagine, after a disaster like this, there are multiple organizations that are going to be interested in providing some assistance. So, we'll try to coordinate our efforts with other organizations to see how best we can help them. They'll obviously need to rebuild their homes as well. The government's going to provide some assistance to each household that was destroyed. There has been a disbursement that's helped them with some temporary shelter, but they'll need some more assistance down the road, again, primarily from the government for the homes. As you can imagine, it'd be very difficult for an organization like ourselves to rebuild homes, because how do you decide who gets assistance and who doesn't? It's very, very difficult, and you can't show any favoritism. So having the community schools rebuilt, which are government schools, is something we can assist the communities with in a much more practical fashion.
And helping to provide critical resources and to coordinate personnel to put those massive efforts forward and help these communities in Nepal. That takes a lot of effort from supporters both here in our local area and abroad. What are the best ways that people can participate and support Detroit2Nepal in these efforts, particularly overseas at this time where there is a great need for critical, vital, basic resources?
So I really appreciate that. This effort just for rebuilding the schools is going to take at least $400,000 that we're in the process of raising right now. All these projects are managed by the locals, and that's always been our philosophy, that they are very capable and very motivated to do these things. They're just unfortunately experiencing poverty. So where we come in is the assistance with organization as well as with funding. So people at home can certainly provide us with great assistance with funding, and those donations can be sent to our website, Detroit2Nepal.org. That's greatly appreciated.
And these are all grassroots programs you put on your website, grassroots community-based programs. That is at the heart of all that Detroit2Nepal is doing, both in Nepal and closer to home in the Detroit area as well. Dr. Keidan, talk to us about some of the efforts that your organization is putting forth to support people in Detroit.
Sure. So again, we work with public health and healthcare and education as well in Detroit neighborhoods. Probably one of our biggest efforts now is trying to increase the accessibility of medicine and healthcare to underserved areas in Detroit. As you know, we're a very wealthy country. We have tremendous resources available, but they can be very difficult to access. We've utilized techniques in Nepal to try to overcome these barriers for accessing healthcare by using what's called female community health volunteers, which are medical lay people that go through a formal training to be taught to engage their community, provide them with education regarding healthcare, and then very importantly, help them access healthcare with the resources that we provide. We build several health posts, which are medical clinics and birthing centers in Nepal, but these are communities that traditionally use jockeries or faith healers for prayers and herbs and don't access Western medicine. So there are a lot of barriers to potentially limit that access to healthcare. So we found the female community health workers to be extremely important. We're using a similar model in Detroit using what's called community health workers. And again, in a very similar fashion, they're trained with a formal curriculum and certified to have the ability to engage the local community and to help them access resources. And these are most commonly people that are trained directly from that community that they serve. So they're trusted members of their community, and they can be much more effective with forming a relationship, forming trust, and then subsequently helping them access some resources, which again are available, but can be very, very difficult to access.
And so, on those local efforts, how big of a role does partnership with other organizations, other nonprofits play into providing these resources to people as they need them and in a way that's most effective to fulfill their lives?
That's a very, very important question, and any nonprofit by themselves is limited by the capacity that that organization has. Once you start collaborating with other organizations that have capacity, expertise, experience, training that will complement yours, you become a much stronger organization. So we work with other organizations, including Say Detroit, uh, the Brilliant Detroit in the neighborhoods, and multiple other organizations through the years to increase our capacity and increase our ability to accomplish our mission.
More information on all the efforts from the Detroit2Nepal Foundation, or D2N, can be found on their website, Detroit2Nepal.org, Facebook and Instagram also for more information at Detroit2Nepal. Dr. Keidan, before we let you go, anything else that you'd like us to know about your organization at this time, or ways that people can get involved locally?
So again, I really appreciate the time, and all your questions were very, very pertinent. And again, I want to stress that we're an organization that, whether we're working in Detroit or Nepal, we respect the communities we work with. They have tremendous talent and ability, and our job is to assist them. And I hope this short interview kind of exemplifies that. Again, for help, the biggest way you can help us, like any nonprofit organization, is with your funding. We can't do this with any of your support. So again, appreciate anything you can do to help us in our efforts.
Again, Detroit, the number 2, Nepal.org for more information, including information on providing donations. If you'd like to help them with their efforts, both here locally in the Detroit area as well as all throughout the world abroad in Nepal as well. Dr. Keidan, thank you so much for your time today.
Oh, my pleasure. Thank you very much.